Good morning, ladies and gentlemen, and thank you for joining us for today's TED Talks. Our first speaker this morning serves as Director of the Office of Crisis Services and Suicide Prevention for the Tennessee Department of Mental Health and Substance Abuse Services. An 18-year veteran in the field of social services, she now works to develop and implement statewide strategy and financial sustainability and ensuring the delivery of quality care to individuals seeking care within Tennessee's crisis services continuum. It was, however, a firsthand experience on the consumer side of the system that helped her to share her fully formed perspective today with her talk titled, The Hidden Force of Mental Health Care, Understanding the Power of Hope in an Imperfect System. Please welcome to the stage, Morenike Murphy.
Welcome to Nashville, y'all. You came for the conference, you came for the music, you came for the party. But for most of you, when you got here, you found the traffic. You see, in Nashville traffic, you can complete a New York Times crossword puzzle, put on a full face of makeup, listen to an entire episode of All Things Considered on NPR. You get what I'm saying. The traffic does not move. And do you know why that is? Because just like you, everyone else heard that we had something good going on in this town. But then they decided to move here. So don't you all get any ideas, because we are full. But seriously, our roads up with the traffic, so it's not a perfect system. But I'm an imperfect system of ours, because if Nashville is so wonderful to attract such wonderful people like y'all, then surely you'll come with some solutions. We can put our heads together and figure this thing out. But the frustration I feel with Nashville traffic is the same way that I used to feel about our system. As a mobile crisis responder for 10 years, I can attest that the system has serious flaws. I mean, many times I would call to connect people with services. I would find that programs were no longer active, people were wasted, programs were disconnected. Sound familiar? People on the other end of the line at shelters, treatment centers, and clinics, they were overwhelmed, and it showed. Some were rude, disengaged, and uninterested in my questions or my intention to connect a person in crisis with the services they so desperately needed. Some would be dismissive and rush me off the phone. And when I tell you I was reaching out for those persons that needed the most help, I was calling on average 10 different agencies looking for help. It was simply a wall of no. We were providing ineffective information about what resources were actually available, and in some cases, we were not able to provide any options at all. So I'll give you an example of this wall of no. As a crisis responder, I met a woman who was seeking our help after escaping her abusive partner. She had previously medicated with alcohol and cocaine, but she was motivated and ready to turn her life around. And so I pick up the phone to make these calls to get her connected to treatment, and every call I make, I hit that wall of no. No beds, no room, no funding, no one available to answer the phone. And when someone would answer the phone, they were frustrated and did not have all of the information about the programs that were available. And so their frustration became my frustration. And I would release that frustration onto my colleagues through rants about state government and the system is broken. And for those of you on the front line, this may sound familiar. You see, the problem is there are fault lines and there are canyons. The Cambridge Dictionary defines a fault line as a break in the Earth's surface. It also defines it as a problem that may not be obvious but could cause something to fail. And where our system mysteriously breaks down and fails is at the two-camp divide of us versus them. There's a wide canyon that helpful resources often fall into because of this mentality. You see, one camp is the front line of case managers and customer-facing workers, while the other camp is the administrative coalition providing services, funding, and developed programs. Within frontline social work, resources are commonly shared and passed around. because we rely on each other to find out what's available and what works. And the same is true on the administrative side. But there is a canyon of divide on the fault line in between them. And when I joined the administrative side, I found resources that I had no idea existed. So I've seen it from both sides of the canyon. And the question is, how do we bridge these two separate camps over that canyon? There are more people working for access to care than what we see and know. Think about it. If just over 400,000 NASA engineers, scientists, and technicians can figure out how to put a man on the moon, then surely over 500,000 mental health professionals can figure out how to organize a system of resources so that we ensure every individual has access to care and receives treatment with the kindness and dignity that they deserve. And so y'all don't think that I'm just up here preaching. I want to share with you that I've lived it. So at my job, I was in the midst of very important work to improve the legal document in Tennessee by which an individual receives behavioral health treatment. And at the very same time, I was noticing signs that my child was experiencing a mental health crisis. As a clinician, I knew he needed hospitalization. But as a mom, I didn't want this to be true. I was afraid that we were going to come face to face with that wall of no. And if we had been met with rude indifference at the hospital, things would not have been pretty. And so I made choices as a mom and attempted to get treatment. Choices that, as a clinician, I knew delayed what needed to happen. But then I got the call that kicked it all off. The chaos on the other end of the line left me with no choice. I had tried everything else because I didn't want to do what I knew I needed to do, and this was the hardest thing that I have ever done. And so I showed up to the hospital with my child, and I was met with such kindness and such patience by every single person that we encountered. The compassion shown to me and my child was overwhelmingly comforting. It made the difference, y'all. The trauma of what was happening turned from a nightmare of paralyzing fear into relief and belief. Relief and belief that he was going to be safe and he was going to be cared for. And so if I, as someone who has been in this profession for 18 years, can feel scared, helpless, overwhelmed, and too frustrated to seek help as a consumer, imagine what that's like for someone with zero experience. It has to feel impossible. I had to learn to trust the system that I worked in and that I'd offered up to families for so many years. I've sat in living rooms and promised families that it was all going to be okay. And I made this promise without really knowing if that was true. But I learned from my own personal experience that it really is true. It really is going to be okay. As a provider or first responder, hope was the knowledge that there were people working to provide more services. As a consumer, hope was the relief that they were going to take care of my loved one and my family as a whole. I could stop panicking. The kindness extended toward me was the key to that peace of mind. And if someone had been rude or indifferent at the hospital, I would have been devastated, grabbed my child, and walked away. Because if your attitude is such prior to admission, then how will you treat my loved one during their most vulnerable time when I'm not around? Now, speaking of hope, everyone knows Chick-fil-A provides excellent customer service, right? Yeah. Right. Their staff has a cheerful and welcoming attitude. They are courteous, respectful, engaged, and interested in meeting my needs. They listen carefully and get confirmation that my order is correct. And Chick-fil-A has a strong sense of accountability and teamwork. Are y'all following me? Yes. Okay. Again, so that y'all don't think I'm just up here preaching, I want to share with you that I've lived it. I've lived Chick-fil-A. So I pull into a newly opened Chick-fil-A franchise with total confidence. I love Chick-fil-A. I knew I would have a good experience, even though they just opened. I ordered a deluxe chicken sandwich with American cheese, because you know they give you exactly the cheese you want. You can have American, Colby, Jack, Pepper Jack, or no cheese at all. So they prepared American cheese, lettuce, and butter on the bun, because that's what I asked for. And I had total faith that I would get what I ordered. I pulled into the order queue and someone was standing outside with a headset and a computer tablet ready and waiting on me. It's as if they knew when I arrived, I would need immediate assistance. They already expected to see my car. Okay, so I did use a Chick-fil-A app to order, so that might have tipped them off. But they knew my little red Chrysler was coming. They greeted me by my name. Hi, Morenike. How may I help you today? I pull around to the pickup window feeling excited about my sandwich, knowing that it's going to be delicious and just what I asked for. Inside the pickup window, there was a lot going on, like synchronized swimmers, a well-choreographed dance of a process. One person knew what the next person needed in order to get it right just for me. They almost instantly handed me my bag, and I didn't even check it before I drove away. I was hopeful that what I ordered was in the bag, because it's Chick-fil-A, right? So as I get closer to home, I reach into the bag to snag a hot salted waffle fry, and what? There were no fries. And I thought, didn't I order fries? But then I instantly knew. If I had ordered fries, they would have been in my bag. My trust in Chick-fil-A is just that strong, y'all. I actually felt guilty that I wanted fries and I didn't order them. And all I had to do was ask. Our system needs to provide that same kind of assurance that if you need help, all you have to do is ask. Giving people the confidence in the system's ability to help them, that is what generates hope. The bridge over the canyon is hope. It is the shared hope of advancing systems and extending grace to families seeking treatment. Hope increases the support, drive, and motivation of staff members and consumers to seek help. An attitude of hope in providers of services can mean the difference in someone walking away from treatment or in the direction toward treatment. Hope can lead the way to overcoming a mental health crisis. You see, knowledge really is power and choice. Knowing that you have options and that there are people advocating within the system to improve mental health outcomes, that generates trust and comfort. And that trust creates faith in a shared system. Don't you want to know that if you have a loved one in a mental health crisis, that they are going to get the treatment that they need? Well, you can participate in making that help available. You have that choice, and you have the power to bridge that divide. So, there is hope in what we do, providing mental health services for people in crisis. Hope can help us fix and improve an imperfect system, and I want you to experience it firsthand. So here's my call to action. I want you to return to your workplace and implement customer service training that embeds hope and friendly customer care. And I want you to find 3 ways within the next week to extend kindness even when it's not shown to you. If you will do that and stick to it, you will reap amazing results. But you must bring patience as a partner to hope, because as I told you, I have great hope that we are going to fix our traffic system in Nashville. So Tennessee Department of Transportation and I-440, I believe in you. And as for creating an effective mental health care system, we believe in that too. Thanks, y'all, and enjoy your time in Nashville.